All right, welcome. The next edition of Lipstick and Logic. I am excited because there's a new product that's FDA approved for treating the neck, a non-surgical product. So we're here to talk to you today about necks.
Okay, lipstick check first.
Yes.
This product just got approved.
Yes.
For horizontal necklace lines.
Okay.
How often does someone come in complaining of that to you?
Not too often.
I'd say probably more now than ever, mainly because people have this,
tech neck.
Tech neck, and they're constantly
Do you buy
looking
it?
down.
Do you believe in tech neck?
I do think that these lines get accentuated more when people are in that position. I mean, if people frown more, they're naturally.
But do you think it's actually from looking down on their phone the whole time that they're causing these necklines?
I think that what is a necklace line? How about it's basically where the platysma, the muscle that depresses the entire lower face, interdigitates with the skin. That's the reason why your skin is not dancing off your neck, because those necklace lines are points of adhesion. Kind of think of like where it's stapled. Your skin is stapled onto your platysma.
I'm in their neck all the time, and I'm lifting the skin off the neck. It's not really that tightly adhered to the platysma. In fact, there's a layer of fat there. So I think it's more etched in.
Very little fat.
You're telling me I'm in the neck all the time.
But there's very little fat. I ultrasound it all the time.
Okay.
So that's the reason why when you inject product, which I guess brings us to bumping up the jewels.
Yes.
Were you involved in this trial?
No.
Okay. Where you inject the neck in those particular lines, there isn't a lot of fat, so the product can be seen more readily than if you inject underneath the skin in other parts of the neck.
So we're talking about these lines that go across your neck here.
Correct.
And they're deep etched in lines.
Yes. But what I tell people is that these necklace lines are one of many different concerns, right? When it comes to the neck. I mean,
Right.
I think that the number one thing that people come into you complaining about when it comes to their neck is
Laxity of the neck.
laxity of the neck, right? And it's really determining, is it skin or is it fat? Because that's going to determine the treatment.
So what do you tell a patient? They come in, they say, Dr. Fabi, my neck is full. How do I treat it?
I tell them I have to assess you. This is not something that's readily done on telehealth visits,
No.
because if it's fat, then you might need to do a little bit of lipo. It depends where the fat is. If it's over this muscle, this platysma, then you can do a little lipo. You can inject it with some Kybella. You can do a little bit of
platysma
cool
is the muscle in
sculpting,
the neck that goes from the SMAS, goes up from the midface down to the clavicles.
and it pulls the entire lower face down.
Yes.
And so there can be
Or it
fat,
pulls it up, depending on where you're at.
and there can be fat over it,
There is fat over it.
and then there's fat under it.
Yes.
And so the bulk of what's causing this fullness is fat over it. It can be treated with the non-surgical modalities that we have in the market, like lipo, subsurface RF, which people call face tight, or thermi, in mode. There's all these devices, right? Or you can do cool sculpting, or you can do Kybella.
So cool sculpting is chilling or freezing the fat.
Right.
There's radio frequency and the laser you're talking about, which is to heat the fat.
Right, because it's very sensitive to heat.
Then there's the injectable agents like the oxycholic acid, which is like Kythera or
Kybella.
Kybella, that's used to actually destroy
emulsify the fat,
Yeah.
right? It's like a little detergent. So that exists, but if it's skin that's primarily causing this issue, then no amount of fat dissolvent or device that freezes the fat is ever going to treat the skin.
So how do you treat the skin?
And so it depends on the degree of laxity someone has. And it depends on the mandible. I always tell my patients is basically the bony support or architecture that holds that skin, muscle, and fat.
The jaw.
The
jaw
jawbone.
muscle.
Exactly, the jawbone.
Yeah.
And there's really not a lot of bony points. Like on the face, there's a lot of bones. The frontal bone that holds up this muscle and skin, the zygomatic bone, the maxillary bone, the mandible. But in the neck, you're really mandible, and then you have your hyoid bone right here, and then you're down to clavicle. So there's not a lot of bone to hold all the tissue, skin, fat, muscle of the neck. And so it's just floating around. So I like to start by assessing the jawbone. And sometimes a weak jawbone, in augmenting it with filler, can really pick up that excess tissue underneath the jaw.
So if you put filler, like an HA filler, like a Juvederm, a Voluma, Define, Refine, one of those, or Wrestling, you put that into the jaw, into the chin, you'll actually bring this angle up and make this angle a little tighter, up to 5 degrees tighter, just by putting filler there. It'll actually make someone look more elegant, make the jawline look more elegant.
So filler might be the thing that you need in order to lift or give the appearance of this.
Filler along the jawline.
But you did a study where you injected just the chin or the entire jawline?
I've done both, but when we prove the cervical mental angle gets more acute or tightens, it's when we put filler in the chin.
Right.
But I know you've put filler, well, we both did studies with filler along the jawline to make the jawline look better. But what people don't realize is the benefit when you treat the jawline to the neck.
Yes. And it's not just bone, right? There's also muscle. And so this is another component of the assessment, because sometimes people come in and it's not just at rest. They show me photos. I hate all this stuff when I smile. Don't you see it? And it's like these kind of like folds that happen,
Right.
like a Sharpay. And so it's extending from the jowl down underneath the chin. And that is sometimes the platysmal muscle.
Okay, and the superficial fat or the jowls that are over it also, and that superficial fat as you get older tends to depress a little bit. And I remove that during a facelift, but sometimes it's difficult to treat. You now sometimes inject, right? You can do a non-surgical injectable agent in there, deoxycholic.
Right, you can do a little lipo, you can tighten it up with a face tight or a thermi, or you could even do a little Kybella if it's truly fat and not skin. And that's the key here, assessment.
Okay, but there's a really important thing that we talked about earlier. I know you're gonna be, this is gonna be crazy when you hear this, but what was the one thing you talked about earlier today in our program that makes the face and the jawline, the chin and the mouth area look so much better that people often overlook?
I think I even stumped you.
Yeah, you did you stumped me.
What was the one procedure that improved all the metrics that we improve with filler in these trials? The nasolabial fold, the radial lines, those barcode lines above and below the lip body itself, the lip volume, the oral commissure.
Corner of the mouth. So it was dentures. Teeth. So it's amazing that it gets often overlooked. And I'll tell you a story. I remember
you got nice teeth.
Thank you.
Yeah,
Invisalign.
really nice teeth.
Wait, I'll tell you, I was in London once in UK and I was injecting someone's mouth and I was on stage. I injected lips in front of, I don't know, 1,000 people or so. They wanted to learn my technique. So I'm injecting lips. I could not get them to look good. I'm struggling. I'm trying many different techniques and I could not get it to look good. And I'm like, I don't know why I cannot get her lips to look good. It wasn't just it just was asymmetric. It was bumpy. And then she smiled and her teeth were like all over the place. And I was like, oh my gosh, I'm not going to be able to get a great result because her teeth were so disruptive to my outcome.
And I think that that's actually the reason why people look so unnatural in this area, because they're not addressing the thing that goes the furthest, which are the teeth.
Yeah.
And I always tell my patients going into their 40s, teeth start to shift. It's probably because of the bony loss that the jawbone experiences, and that's what's supporting those teeth. And so as they start to shift and invert, they go in, the lip follows it, right? And so all of a sudden the lip looks smaller, the corners of the mouth look more accentuated. These folds, these melomental folds or the marionette lines look worse. And it's really because your teeth have shifted inward. It's not because you've lost all this volume in like 1 year along the mouth. And so getting the Invisalign or the braces sometimes are necessary to really widen the palate.
But this all stems from the bone loss. A lot of this bone loss. And women will lose 10 to 20% of their bone within the first 5 years of menopause. And that they really have a lot more bone resorption than men. And also the nose drops. People are always like, does my nose get longer? It's not that your nose is getting longer. It's that you're losing maxilla. You're losing bone. So the nose loses its support and it falls. Now I am in the office here and surgically, but in the office, I'll inject filler to replace where that bone is. And I inject deep down onto the bone and it gives the illusion that there's more bone there and they look so much healthier and youthful.
Right. By injecting, I think you did a study, by injecting this bone, the maxilla, not just the piriform, which everyone is like always thinking about, but even you've covered the anterior nasal spine, you can not only make the appearance of the nose look like it's rotating up, the tip.
It projects it forward.
But it brings the upper lip forward, which you showed so beautifully in and can give the illusion of a shortening of the cutaneous lip, which is this part of the lip that's skin, which is a visual QH.
So it's a little trick to make the lip look better. And this is tell this into your injector. If you're going to your injector, say, listen, I want my lips to look better, but I don't want to inject on my lip. Can you do something else? Because a lot of people don't know about this, but it makes such a nice, subtle, natural improvement in the lip by injecting deep underneath the nose. It lifts the whole lip up and gives a more natural lip. And that brings me to what you showed me today, because you showed me this incredible photo of this patient you treated. You injected the mental labial sulcus, I believe.
The labiomandibular sulcus, which is basically the space between the lip, labial, and bone, mandibular sulcus groove.
So you injected this area with an HA, hyaluronic acid, like a Restylane or a Juvederm or a Belotero or a RHA, and you injected down there. And I looked at your patient's picture, and the lip was projecting forward. They had a better proportion to the lips because a lip that was looking very like aged and atrophic all of a sudden looked a lot better after you injected deep down here. So you didn't actually inject the lip.
Right. It's the frame of the lip. That makes up the frame of the lip. Right. And so if you're looking at the lower face, even in this study with the dentures, the jowls look better, right? Because the jowls are partly because the depressors of the lower face are activated. They're pulling the lower face down, the muscles. But if you give that muscle volumetric support, which includes the depressors of the lip, the DLI, the depressors of the corner of the mouth, the DAO, and
these are all muscles. DLI, DAO are muscles of the lower face.
If you support it with teeth that push it forward, then all of a sudden you don't have as much downward pull, and the jowls also look better.
So you get a lifting of the jawline and the jowls if you inject probably. Now here's the key. You have to inject it into the right muscles.
Right.
And those muscles are nuanced and they're small and you have to know where they are. Not a lot of people know where they are, but that's one of the reasons we teach about it. And then recently, you and I were both in a clinical trial for a product that's now FDA approved for the neck, a toxin product. You want to talk about that a little bit?
Right. And so in relaxing the greatest muscle that depresses the lower face, which is the neck muscle, people are sometimes like, wait, you want to inject my neck to address my lower face? Yes, because this neck muscle is the greatest oppressor of your lower face. That's what it has to do with. Then we were able to see not just an improvement of the bands, but we actually saw more jawline definition in the trial.
So this muscle here is called the platysma muscle, and it's now FDA approved to be injected with Botox. So both of us were in the trial, and we injected this here with Botox. What happens when you inject this platysma muscle is you get a relaxation of the platysma muscle. The neck comes back a little bit. You get a little bit better cervimental angle. The jawline can come up a little bit, and it actually looks so much more youthful. And then they don't have the bands. So when you go you'll see those bands. And get rid of those bands. Those bands also, the platysma muscle pulls down the corner of the mouth. So if we weaken this, the corner of the mouth goes up.
Yes. So sometimes when people come in, to your point, and they're complaining of this, it could be fat, it could be skin, it could be muscle, especially when they smile and animate, things bunch up here. Right. That's the muscle. And so in addition to all of these things, you can also, now there's all these skin tightening procedures, but I always kind of start with where we talked about first: fat, bony architecture, and then muscle. And then I find that once those things have been addressed, the non-invasive, like energy-based treatments that we're constantly seeing, whether it's all therapy or soft wave or ZERF now that's out, those things can do a better job. But if you don't address the underlying architecture first, I don't think you have a chance that you're going to get.
And then surgery is always the gold standard, in my opinion. So there's some people where non-surgical is only going to get you so far, and it's time to do a facelift or a neck lift. And in those cases, they make incisions around the face, and that's a whole nother topic than after this. But having said that, there's a lot of great non-surgical options to improve the neck, and the results you were showing are incredible. Like I was sharing it with my fellows and my residents in plastic surgery, facial plastic surgery. I'm saying, look what's possible with non-surgical treatments. It's really quite impressive what you did with lasers and non-surgical treatments.
But something that you did a study on, which is, you know, the reason I think that all of us practice aesthetic medicine is not to just make people look good, but it's to make them feel good, because we've realized the power of this, right? And is it just because they look in a mirror and they feel good? I don't think so. You actually proved that if you put a little bit of filler in the downward corners of the mouth, people felt better. Tell us about that study.
Yes, so it's actually the corner of the mouth down into the chin, reducing this medial labial sulcus or marionette lines, was that actually able to raise the corner of the mouth, and people were actually happier. Now, why were they happier? And my theory was because I was forcing a smile. If you force a smile, you become happier. If you frown, you become angrier. Expressions come first, then the emotion. So it's not the opposite. It's not you feel bad and then you frown. It's you frown and then you feel bad. And the reason why it's very complex, but actually rather simple too, is when you look at someone, you mimic their expressions so you can empathize with them. It's human nature. That's what we do. We don't even realize we do. We do it subconsciously. So if you smile, you become happy. The person you're talking to also becomes happy.
So you might be more likable if you're smiling all the time.
You make a better first impression.
But if you're sitting there with a resting, angry face, then other people may perceive you as angry, feel angry in your presence, and not like you because they don't like the way they feel.
So there's a huge psychological component here to treating the face in the right places, but just a little bit. Because if you put too much, you reduce the micro expression, someone picks up on it, you actually create a negative impression. And that's the nuance of how you make someone look better and feel better without anyone else knowing what's going on.
Right. It's just the right amount. It's like when cooking. It's like you need a little bit of salt, but not too much unless it's your plate. Because otherwise it's like too much of anything that's good.
It's the hardest thing to teach to residents.
Well, I think that's where the art of it is, right?
That's the art of it.
And that's where it goes from, just prescribing a dose of antibiotic, a generic dose. This is where it goes from just being prescriptive to actually the art of aesthetic medicine, where it's something that can art be taught?
So and this is interesting. We just published a paper on neuroaesthetics, the brain-skin connection and how your brain perceives beauty and attraction. One of the papers we cited in that article was the art one, which I love. I took it from the art literature. When expert artists look at a painting, eye tracking studies were done to follow their corneas, to follow their eyes as they're looking at pictures, paintings. And the art expert looks at the outside of the painting and looks at the different objects within the painting and how they work together. What's the harmony within that painting of the different abstract features? Whereas the novice looked at the individual objects within the painting and at each of the borders and outlines of the individual objects. And I'm like, oh my gosh, this makes so much sense because it's so similar to what we do in aesthetic medicine. If you go to a novice injector or someone who's just getting started, they're great. Or maybe they're going to be great.
Or they have good hands, maybe.
But it takes a while before you are able to see all the features of the face and how they work in harmony. So, for instance, when you look at a lip, you're not just looking at the lip, you're looking at its relationship to the chin, to the jawline, to the nose, to the eyes, and you're looking at how those micro expressions work together. If you can't see the harmony of the face and how it works, and you just focus on one feature, then you're going to get into trouble. Because if you focus on that one feature, you're going to make the lips too big, or the nose too small, or the eyes too wide, and their person is not going to look natural.
Right, because you might have a perfect cheek, but it's not in the context of the entire face, and that won't make a difference, right?
Right.
So,
experience matters here a lot when you're seeing someone who is doing facial treatments, because yes, there's an inherent skill that some people have and some people don't.
The skill of the hand,
right?
That's one.
Oh, the eye too, the aesthetic eye.
And
not everyone can be, a professional athlete. Not everyone can be a NASA astronaut. Not everyone can be a Navy SEAL. There's some people who just have the inherent skill.
You're telling me I can't be a Navy SEAL?
No. There's a lot you can do, but that won't be tough. Although I've learned to never doubt you can't do anything.
Good man.
But there are people who are going to, I have fellows and residents I've been teaching for 20 years. Some come in, I'm like, he or she's got great hands. She's got great hands.
Right. But what I've learned is that even if somebody has great hands, a nice steady hand, controlled hand, one that doesn't move abruptly, they still may not have an artistic eye.
Right.
Right. And it's the marrying of the two.
Right.
Where talent rises.
And decision making too.
And decision making, doing the right thing.
Yeah.
Right.
That's all that matters.
Yeah.
All right. There's one thing before we conclude. I want to talk about the neck a little bit more because we started with the neck. And why do people treat their neck? And me, I always like to look into the why of everything and push these psychosocial boundaries of this. So I've done some papers on this as well, looking at how important the neck is to interpersonal communication, especially courting, mating, friendship, relationships.
The evolutionary biology of the neck.
The evolutionary biology of the neck. And it is the third highest erogenous zone on a female body.
Who knew?
Ranked by women. So what does that mean? Well, they ranked 48 body parts, and the first two you can kind of guess. The third one was the neck. So it's an erogenous zone, which means you actually do get an emotional influence from someone kissing, touching your neck.
Right.
And women, this is a study that was done at the University of Missouri.
Probably a lot of oxytocin receptors on that neck.
Oh, yeah.
Because think about it. When someone kisses, you kiss the lip, right? But then you go to the neck too. And it has a lot of nerve endings.
Yes.
And we know that a lot of those calcium channel ions, the piezoreceptors, are intimately associated with they're mechanoreceptors that probably are in areas where you have a lot of sensation.
Yes. So it's an erogenous zone. So a lot of sensations in the neck that then influence you subconsciously to make you more attractive to someone. So what does it mean? When someone will open their neck. Now we look at these vampire movies and a woman gives her neck. What does it mean when she gives her neck?
Is that what I'm doing right now?
Yeah. So women do this subconsciously and they don't even realize it. So there's a study was done where the University of Missouri, where in the psychology department, where they went in to observe women in singles bars and universities and the snack centers of the universities and also in the library. And they watched men and women interacting, and it was all done anonymously. And when women were interested in a man or flirting, she would expose her neck, tilt her chin a little bit, and maybe even stroke her neck with her fingers. Hair flip too sometimes. But exposing the neck, touching the neck gently was a signal to a male that she was interested.
Not just a vampire.
Yes.
Okay.
But isn't it because when we watch these vampire movies, it's always like a woman like, oh, giving her neck. But there's a science to it.
Right. So, it's interesting. We covered a couple of things on the neck. The skin of the neck, it's an area that people forget to put sunblock on.
Yes.
We see a lot of what we call poikiloderma, this like red, brown blotchiness. I treat a lot of women with lasers for it, but it's an area that doesn't inherently have a lot of fat laterally out here. And so we know that those stem cells reside in that fat. And so it's an area that gets damaged but doesn't recover as well. And as we get older, we go into perimenopause and menopause. The skin of the neck is also one of the thinnest skins of the entire body. And it doesn't have the reservoir. As you lose that collagen that you mentioned, what was already thin is now getting thinner. It doesn't have the fat to really support it. And so here you are with this beautiful face and then thin, bottled, crepey looking neck that can really give your age. And I would argue that even a facelift can't really address the cutaneous changes of the neck.
It doesn't.
Right? And so here would be the other pearl that I would impart to those that are watching. It's like, even if you do the facelift, I almost find that with the undermining that vasculature can look worse. And so I get even blotchier necks, really tight faces, but even blotchier necks. So I am excited about this new gel that was approved to inject the neck. Because we did see improvement in hydration and skin quality biometrics when we injected with what is available as SkinVive in the United States. And
so the skin looked healthier, more hydrated.
The skin looked healthier in addition to the necklace lines, which is what we were really trying to improve. And so we're giving attention to an area when people are looking for natural, you can get these beautiful natural looking outcomes on the face. But if you don't have the skin of the neck, the chest, and everywhere where that head sits on to match it, then inherently it does look unnatural because it doesn't look naturally placed on the rest of the body.
Right.
So, doctor's notes.
Okay. Takeaways from that is that there's many options between the neck today. They stem from superficial, minimal, non-surgical treatments all the way to surgical treatments. But the key is assessment and seeing someone who can give you a wide spectrum of those treatment options that are best for you.
Right. Assessment being the key.
Yeah.
Anyone can probably treat, but it's the art of the assessment. I'd say number 2, don't underestimate your teeth. Sometimes seeing one of us might be the wrong person to see. Perhaps starting with your aesthetic dentist or orthodontist to see if your teeth are shifting and there's an opportunity with Invisalign or even braces to avert those teeth. If you do it in your 40s, your 60-year-old self will absolutely appreciate you for it. And if you've already done Invisalign, use your retainers at night so that they don't shift.
Okay, and I'm going to give you a third one. And don't forget the neck, which we touched on. Too
Right.
many people are like, my face, whether it's sunscreen or surgery or neurotoxins or fillers of their face.
Skincare.
Or skincare. And they overlook their neck, and there's a disconnect when the neck looks aged and the face doesn't. So consider the neck when you're treating the face as part of the whole package.
There you go.
Thanks so much.
Thanks for joining us today.
See
Bye,
you
guys.
soon.